Hi, today I will be talking about compulsive behaviors and different subtypes that are also considered compulsive. Compulsive behaviors is defined as persistent and repetitive thoughts and actions that an individual feels driven to perform, often in response to intrusive thoughts or anxiety. This can have negative effects on health, relationships, jobs, and just daily life. The first topic that I would like to mention is OCD, as I'm sure you all have heard of it. Dr. Dean McKay is a professor at Fordham University, a college in New York, and he runs a small clinical practice as well as researcher at Fordham's Compulsive, Obsessive, and Anxiety Program Laboratory. Dr. McKay insinuates that there are vast variations of symptoms of OCD, and he has never seen two people with the conditions that have exactly the same symptoms. A few different subtypes of OCD are like obsessive feelings of being contaminated, which the individual may encounter with compulsive washing or cleaning, an obsession with symmetry and order, with compulsive of arranging and counting, and intense thoughts of harming oneself or others, or religious or sexual obsessions with checking compulsions. These symptoms can cause major distress if left undealt with in an individual's life, and it affects approximately 1 to 2% of the population. OCD can often be treated through therapy, specifically cognitive behavioral therapy, in which there is an exercise called exposure response prevention that helps the patients get exposed to their obsessions without giving in to their compulsions. Dr. McKay also noted in this article that people suffering from OCD often do not get the right treatment because it frequently goes misdiagnosed with anxiety or undiagnosed. Second on my list, I would like to talk about compulsive texting. And the article that I found through the American Psychological Association website hypothesized that teens' usage of cell phones, specifically compulsive texting, could potentially be considered similar to compulsive behaviors among other adolescents. The article defined compulsive texting as problematic because of the risky components that can be included, such as texting and driving, sexting, and bullying through text or social media. About 4% of teenagers in the United States are considered problematic internet users. The dependency of the internet and texting can be positively associated to problems with social, educational, and occupational functioning. Next, I would like to talk about compulsive lying, or it's also known as pathological lying. Compulsive lying can be defined as falsification entirely disproportionate to any discernible end in view, may be extensive and very complicated. It can be manifested over a period of years or even a lifetime. And in the absence of definite insanity, feeble-mindedness, or epilepsy. So over 100 years ago, pathological lying was defined in the scientific literature. However, since then, the interest in pathological lying has been slowly declining. Since pathological lying is not a mental health disorder, there has been little research, and the effects on an individual's level of function still remains unclear. it is still unknown why some people develop pathological lying, and the research still do not know if the symptom is treatable. So, yeah. So that is all I have today. Thank you.